Welcome to our detailed breakdown of diathermy, also known as electrosurgery. We'll cover the technology, its types, and crucial safety considerations. First, let's establish what diathermy is and how it functions in a surgical setting. Diathermy uses high-frequency alternating electric current to generate intense, localized heat. This heat is essential for cutting tissue and achieving hemostasis, which is stopping bleeding through coagulation. Operating between 300 kHz and 2 MHz, this high frequency is crucial. It prevents the current from stimulating excitable tissues, like muscles or the heart, avoiding dangerous spasms or ventricular fibrillation. The effectiveness of diathermy relies heavily on the concept of current density and how heat is produced. In physics, the heat energy produced is directly proportional to the square of the current multiplied by the electrical resistance of the tissue. Heat production is heavily dependent on current density. At the small surgical tip, high current density generates intense heat, enabling cutting. Conversely, a large area, like the patient plate, ensures low current density and minimal heat to prevent burns. Let's look at the first main type, unipolar or monopolar diathermy. In this setup, the current flows from the active electrode through the patient's body to a large return electrode or patient plate, and then back to the machine. This large plate disperses the current safely. Unipolar diathermy has various modes. The cut mode uses a continuous sine wave, while coagulate uses an interrupted high voltage wave. Blended combines both for simultaneous cutting and stopping blood flow. Next, we have bipolar diathermy, which operates on a different principle. In bipolar diathermy, the active probe resembles forceps. The current flows down one tip, through the tissue, and immediately returns up the other tip, strictly localizing the current path. A key advantage here is that no return plate is required, as the current does not travel through the patient's body. This makes it ideal for delicate surgeries, needing precise coagulation. Understanding safety protocols is paramount when using this powerful surgical tool. For unipolar procedures, the return plate must maintain full contact with the patient. Even partial detachment can increase current density at the edges, leading to severe burns at the return site. Diathermy can interfere with pacemakers, potentially inhibiting their function or triggering a defibrillator shock. Whenever possible, use bipolar diathermy for these patients or place the unipolar return plate far from the device. The smoke produced during electrosurgery is hazardous. It contains toxic chemicals like benzene and viable biological materials. Proper suction and filtering of this plume is mandatory to protect operating room staff. Finally, a fascinating historical side note and a quick recap of the key takeaways. Historically, modified surgical diathermy machines were used by the British during World War II to jam German radar beams, proving the technology's unexpected utility beyond medicine. To summarize, diathermy uses high-frequency current for cutting and coagulation. Remember the distinction between unipolar, which requires a return plate, and bipolar, which is localized and safer for patients with pacemakers. Thank you for watching.